Dr. Hurst, we've heard that you've got this fancy new laser device here in your dental office. What can you tell us about it?
Yeah, it's a laser that we treat periodontal disease with, and it's a lot less invasive to treat disease with this laser compared to the older method of using a scalpel and a drill to take care of the periodontal disease.
So a lot less downtime for the patient. But when you say periodontal disease, what does that mean? What if I've got periodontal disease, what are the symptoms I'm going to be seeing?
Well, when we check people, we can find the pockets, called pockets, where there's bone destruction, swelling of the gums, infection. But most people don't know they have it. It's more of what we would call a silent disease, where people have that happening, but they don't even know.
Okay, so that's why when we come in for our checkups, you're sticking those nasty metal things down into our gums to check.
It's a little teeny probe. We try not to push too hard, so you do feel it. It's a little teeny wire. We check around every tooth and measure how deep the pockets are. A normal pocket's 3 millimeters. Some people get like 5 to 12 millimeter pockets around their teeth.
So that sounds pretty dire, and this sounds like a really good way of dealing with it.
Yeah, it's less invasive. People heal really quick, and it's like taking a sliver out of your skin. Once you get the sliver out, it heals really fast. It's like that with treating people with the laser. It's very effective.
Okay, so you're going to give me a little demonstration right here of what we're looking at.
So I'll draw a little tooth here, if I can get the pen to work. And this is the bone around the tooth, and we'll put little circles there representing the bone. Make the root a little bit longer. And here's the gum tissue. And so a normal pocket will just be right here in the gum tissue, like right there. And the bone's normal, there's no destruction of the bone here. Okay. But if you get these little pieces of calculus hooking on the tooth, like little pieces of pepper, they adhere to the side of the tooth. And then the bone doesn't like to be around that, so the bone tries to get away from it, and it creates what we call a little pocket. And then that calculus will work its way down around the tooth a little further, and then the bone doesn't like to be around that, so it works down a little further and makes this little pocket here, and it becomes all red and inflamed here. And so now instead of 3 millimeters, you can get like a 6. If you measure down in here, it'll be like 6 millimeters. Wow. And this calculus goes down even further. And it keeps going down further and further. It can go down all the way down here, work its way down. This might take several years to occur. And then the tooth starts getting loose, and then they lose their tooth. So
basically, if it gets too far along, you are going to start losing teeth.
Right, exactly, that's the problem. And also people, because of this high amount of inflammation in your body, there's a lot of germs going through your system, and people have a greater incidence of cancer, of premature births, and heart attacks and strokes from having all this inflammation in your mouth. It affects your whole body health-wise.
Wow. So when you are able to go in now with a laser, how long is the recovery time after?
Well, within a few days we have them start brushing. We have them be careful and rinse for a few days, not brushing, and after about 2 days we start having them gentle brush, and it takes a month before you can brush fairly good, and then after 2 months, then you're healed up. After 2 months, totally healed up. Some people heal really fast. I did one the other day, and in a week they're looking really good, you know. But you have to give it time for the body to heal, and so even though it looks really good, it's healing underneath, so you kind of need to be careful with it for at least a month. But people don't really complain of pain. I've done many of these, and I haven't had a person complain of having pain like you did when you did the scalpel. They just don't complain about it.
Yeah, I can only imagine how ghastly that used to be when you're literally hacking away pieces of your gum, right?
Yeah, that's what you're doing. But I wouldn't say hacking, but just removing.
Sorry, I shouldn't have said hacking. What's a more delicate tone?
But there is, and whenever you work on the bone or a tissue, there's an inflammatory response, and this is a minimal invasive thing, so the inflammatory response in this procedure is very minimal. That's why they don't feel pain, is because there's not destruction, and the body doesn't notice much being done. So it's
just a lot less invasive. And this is obviously why people need these dental checkups anyway, because like you say, you may not even know you've got this going on.
You can catch it early when it's happening. But I have a video.
Okay, let's take a look at that.
But see, that's a demonstration of the laser fiber. It's a little
that's
fiber.
the actual
It's a
laser.
little. This is a kind of a cartoon that shows the laser fiber going down in there, and it's removing the lining of the inside of what we call the pocket. It's disinfecting. That laser just penetrates through. That's representing the germs. So it penetrates all through the tissue. It's and it cleans the tissue. It destroys the bad germs. And it's a certain wavelength that goes after germs. Now you see this little cleaning device. We go in there with this with a special liquid. It disinfects also, and then we clean off the sides of the teeth. You can see there with all the hard deposits, that calculus. So it removes all the bad stuff. And then we go back in a second time with the laser, and use the laser one more time to further disinfect and cause a blood clot to form. And then you just that represents the blood clot forming. And then you just let it start healing. We have the patient go on special mouth rinses and gentle brushing for don't brush for a couple of days, and gentle brushing for a couple of weeks, and you can that's demonstrating how the gums heal up.
So what I'm thinking is, when it used to be down to a scalpel, you probably get a lot of bleeding and discomfort. Not so much with the laser?
No, there's very little bleeding. We aren't doing much harm at all, just removing a thin lining on the inside of the tissue, removing the debris on the teeth, and then sealing it up. And so, because there's not much destruction, there's not much swelling, not much pain at all.
And of course you numb it anyway while you're doing it.
Yeah, you have to numb it. They'd feel a little bit.
Stinging, perhaps.
Yeah. So just numb them up and do it. People go through that quite well. So.
Okay. What's this little fellow here that you have?
This is a model. See, the model of normal tissue is pink, and then this is red tissue. So this would demonstrate how there's stuff, calculus caught on the sides of your teeth. So you're removing all that material off your teeth, and then going around the laser there and cleaning off the pockets. But years ago, we would take a scalpel and remove this tissue, and then smooth off the bone, and there was quite an inflammatory response to that. And so we're not doing that heavy-duty work, and so now it's a lot less invasive.
Wow. So basically, if you do need this kind of thing going on, if you have this kind of thing going on, the laser just sounds like a really superior way of taking care of this periodontal disease. Where can we find all this technology, Dr. Hurst? Where's your office?
Right here, below the LDS Temple, 150 East 200 North. And I also wanted to offer people, if they wanted to do the laser, we could do an exam on them and check them for free. We have a special going on right now. We give people 20% off the normal fee if they wanted to come in and do it, which is substantial savings. But we've done hundreds of them, and they've been very, very successful, and we'd like to see more people do it. There's a lot of people out there that have gum disease but that don't even know they have it.
Right.
And
Well, this is just a great way of taking care of it. So yeah, if you do not want to face a scalpel, come down and face the laser. It seems like it would be a lot better. Thanks, Dr. Hurst.
thank you. Nice to talk to you.
Nice to talk to you.